Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so excited to introduce our guest today. Her name is Dr. Debbie Raphael. She is a licensed, double board certified Diplomate of the American Board of Psychiatry and Neurology, and a UCSF fellow trained child and adolescent and adult psychiatrist. She is the author of Carry My Strength, 36 Pillars for Positive Parent-Child Experiences, a former UCSF assistant clinical professor and lead Contra Costa country child psychiatrist. Dr. Raphael has been a practicing member of the American Academy of Child and Adolescent Psychiatry for the last 2 decades. She graduated summa cum laude, Phi Beta Kappa from UC San Diego, where she studied animal psychology and neuroscience with a minor in sociology, and was a Regent Scholar and earned a Howard Hughes Research Scholarship. Dr. Raphael has published several academic articles and has been an expert contributor to Parents Magazine and a former newspaper advice columnist for the Contra Costa Times, now East Bay Times. And she is here today to share what she has learned through her parenting journey and also her journey as a psychiatrist in terms of how to parent in the most productive way and raise the most resilient kids. With that, let's get to Dr. Raphael.
Thank you. Thank you so much for having me on today.
Yes, I'm excited to hear all of your thoughts and wisdom. You have many years of experience. Can you talk to us a little bit about your work career or kind of like what has led you to where you are?
Yeah, definitely. So I've been in practice for a couple of decades now, seeing as a child, adolescent, and adult psychiatrist. First I did my psychiatry residency at UCSF and then my child and adolescent psychiatry fellowship there at UCSF. And when I started my fellowship, I had my first baby right at that same time. And so the learning trajectory at that time was really, really steep because I was gaining the lived experience as a parent at the same time as absorbing all of this information on that. And so at the time, I started to keep a journal on what I was learning at work and at home and was reconciling the two to kind of see what applied, what I was seeing in the room with patients and families, and kind of thinking about how I could apply that to my own parenting with my baby at home.
Sure.
And so I kept that journal and I've been adding to it over the years in my own parenting. So I worked with Contra Costa County as a lead child psychiatrist for a number of years. And then now I'm working for a group practice, but I see kids and adults. So I've worked with a lot of parents over the years as well. So more recently, I've worked on kind of converting my findings in the journal into the form of a book that can be more accessible. So that's ongoing at this time. But in the process, I've learned and consolidated so much so that I'm so happy to share with parents and people who can benefit from it.
Yes, I love this because I think oftentimes, like when we are in mental health, we get a different experience than the average person does, and it can be so helpful for us to share what we know. So I'm so glad that you're here to share this information.
Thank you.
Yes. Okay, so let's talk about, I think, when we think about connection, and this is one of the things that you really emphasize is the importance of connection and that it has benefits both physically and mentally. Can you talk about, as your experience as a psychiatrist, what is connection really look like? Like when we say like be connected to your kids, what are we talking about?
Yeah, that's a really important question, because connection, it's really at the foundation of everyone's development. And ultimately, like you said, mental and physical health. Um, there's kind of a newer term called relational health, and
Yes.
that's something that's starting to be talked about as it pertains to really early life, and how babies connect to their caregivers, and that reciprocal relationship and exchange that takes place, that's found to be so important. and and that exchange that takes place, one of the reasons why it's so important is it really contributes to the self concept and sense of self of the baby, and then the developing child. And that relationship really doesn't stop just because they stop being babies, right? It really continues over time and through development. And that connection serves both the child in his or her own development and sense of self, but also the parent, and how they're doing in their relationship to their child.
Sure.
And yeah, and then as that relationship kind of goes on, it's so important to tend to, um, because there are things that can happen through life, right, associated with stressors and so much of what we go through, and harder things that can happen. Like verbal abuse when a parent is very stressed, or when that relationship isn't so protected sometimes, or even if it is, but stressors can get the better of people. Verbal abuse, that can happen, like physical abuse, or at times, or kids just not feeling safe and secure, in the home, and having that feeling. um, these things are all called adverse childhood experiences, like in the literature. And
Mm-hmm.
when adverse childhood experiences take place, they can come to affect health over time, especially if they reach a certain threshold or number. And when we talk about health, we're talking about mental health and physical health. So,
Yeah.
of course, I think probably a lot of people have heard of PTSD,
Mhm.
post-traumatic stress syndrome, when things have happened at home, or outside of the home, that are traumatic in nature. And then some people can develop symptoms that last over time associated with that,
Mhm.
particularly at an elevated stress response, right? But things like depression that can persist, even later on, heart disease, kidney disease, cancer. It's really interesting, these associations that have been made over the last couple of decades between health and a history of trauma. So anything we can do to really protect is in everybody's interest. And what's so interesting is, more recently, positive childhood experiences have been identified to kind of counteract and buffer any adverse childhood
Mm.
experiences that have taken place. And they seem really obvious, like I said before, like that feeling of safety and security in the home. Also having a couple of adults outside of the home that kids feel connected to, can
Mhm.
be very protective. Having rituals and community traditions can be protective, things like this. So there's a lot that can be done, but the general theme is connection,
Yeah.
right? So connection itself is very protective for health throughout.
That's so amazing. So when you say like rituals, is that meaning something religious or is it just something consistent that we do?
Anything. And it's interesting because we think about, okay, what's behind it, right? I think it's a sense of comfort and
Mm.
familiarity,
Sure.
and connection, right? So they
Mhm.
so it can be religious, or it can be just some kind of family tradition that you have, or a tradition with people outside of your family, but something that makes you feel connected,
Mhm.
and like that sense of familiarity. So
Yeah.
there's lots of ways someone can have that. And I always like to say, even just having dinner together, like as a family, even from time to time, if it can't be every night, is an example of that kind of ritual, which can
Yeah,
make people feel secure and safe and connected and important.
sure. Yeah,
Yeah.
absolutely. Is there other like simple things that you can think of that families can do to increase connection, or this idea of relational health, bringing that more into their home in like a simple way?
Yeah. So having, again, meals together as a family is one. Another thing is something really simple but really valuable called special time, which is something that we talk about in child psychiatry, where it's spending like a really short period of time, generally like somewhere between 5 and 15 minutes, with your child. And it's, what's kind of different about it is it's just child directed, like there's no agenda to the
Mhm,
time. And
mhm.
in today's times, that's less common, right? Because we're so like busy with agendas. But special time is just being with your child directed, just kind of see where it takes you. And so that simple act of special time, whenever you can make it happen between 5 and 15 minutes, has been shown to kind of like pay dividends, over the years in terms of the relationship. Because, and then you think about why, right? Probably because the child feels seen, heard, important in the
Mhm.
relationship. And again, it all develops their sense of self and contributes to that, which will stay with them over time. And the more they have that, the more effective likely they'll come to be in the relationship with us as parents. And then it kind of propels a virtuous cycle, right? A positive
Yeah.
cycle, when we can do just these little things.
Hmm.
So
Well, and I think that makes it so much more approachable for parents, because oftentimes they feel like everything, or like sometimes I'll be like, oh, I just don't have like an hour right now to spend on each child. I have 4 kids. And so if I spent 1 hour on each kid every day, that would be 4 hours, right? Like that would be,
right.
we would
Good
be
job.
up so late, right? Like that would be literally a part-time job, which I know parenting is a job, but it's that part of like, okay, so what can we do that makes a great impact
Right.
in our relationship with our kids, and us relating to our kids, that makes them feel special, because we definitely feel that way. So I love the idea that we can create that connection in small doses, and that is pays dividends even in that small amount.
Yeah, exactly. And it doesn't have to be every day. It can be just whenever you're able to kind of make that time, but to really kind of notice it and appreciate it, when that is able to happen, so
Yeah.
that it can be that sort of just non-directed, time that's just kind of about your child, even if
Mhm.
it's not super, super often, as long as it
Yeah.
happens and they feel it. Mm.
Yes. Well, and I think, something that my kids really like when we get to go on dates with our kids, like sometimes we'll get to go individually with each kid. And it's not something we can do a lot of times a year, because it creates a lot of orchestration, right? Like there's a lot of ways to make it happen. And so, but if we put it on the calendar, them knowing that kind of time is coming up, or even like if there is a way to schedule out, like, on Fridays that we do this and we alternate with special time. Like I love that idea. And sometimes I don't know if as a parent you felt this way, but there's so many things on my mind that sometimes I forget to do the things I do really want to do, because there's
Right.
just so much going on.
Right. So, like you said, to kind of mark it on the calendar, that can be really powerful. And also, even mentally and emotionally, like them being important enough, right, to have a place on
Yes.
your calendar. And then you can even like talk about it, like, oh, on Friday, I'm looking forward to doing this. And then they know you're thinking about it in your mind
Mm.
too. And that, again, it's like valuable enough to have a
Yes.
place there on the schedule. So
Yes.
it's
Yes.
meaningful. Yeah.
Absolutely. Well, and I think, yeah, we can be so rushed. So this just came to my mind. Like oftentimes I feel like families can be really over programmed. Do you
Exactly.
find that happens in society too?
Yeah, I mean, I think it's a product of today's times, right? It's kind of a really busy time, and that's reflected in so many ways now,
Mhm.
right? with social media and people scrolling and spending so much time on that because there's so much to be seen, right?
Sure.
It just is sort of never ending. And then just with the schedule itself and the over programming and so many activities that people can participate in, expectations seem to be increasing around everything too, and all of that can feel really really stressful for parents who are kind of stuck in the middle of this kind of over programmed culture. And then the relational aspect of things, like we've been talking about, maybe could seem to some as less important because people can get caught up in this, completely understandably, because this is sort of what's happening now. But I think it's really important to remember to kind of try to realign with the relationship and emotional aspects of what's going on, both in the family and at home and outside of the home and societally.
Yeah. And it's hard, especially if your kids' friends are doing a lot of activities. I feel drawn. Like in our house, we said each kid could do one sporting activity and one like other activity. So like music or something creative or artistic. And so that was like the balance that we created, having 4 kids and trying to get all of them to all these different things. But then it was like, okay, one kid's friends, like everybody's playing soccer. Well, now she wants to try soccer and she already does this other sport, right? And then you're like, oh my gosh, like how are we going to make it all happen? Do you think part of protecting our kids is also setting boundaries? Like, is there a part where if it feels like too much for us, that maybe it's also too much for our kids?
Yeah. Boundaries all around are super important to be aware of and to keep in mind. So as an example, something we talk about in psychiatry and child psychiatry is the notion of authoritative parenting. This is just as an example of balance, right? So that's kind of the combination of being warm and loving and firm and having limits and boundaries, right? So it's the balance between those two. But that has been identified as one of the most effective methods or ways of being in parenting is to have both, right? And so boundaries and limits are really important for everybody, for us as parents and for our kids. And like you said, our worlds intersect, our lives intersect, and so if we're feeling like something might be too much, maybe it really is. And so talking with our kids about that to navigate what's really important to them, to identify that with them. Is it that your friend is doing this? Is it because you really want to try it because you might really like it? Maybe the friend part is really important in their world, in their social world. So kind of trying to figure that out, and also trying to figure out what might be too much versus what might be okay. And it's interesting too, because sometimes our temperaments might be different from our kids.
Sure.
And
Yes.
maybe something really is okay for them, even if it feels like too much for us. So trying to kind of sit back and think about that. And then if it seems like maybe it is okay for them to add something else, but it's really logistically also too much for us to manage, that's when maybe we can think about our village, right? Who might be able to step in to help, to facilitate for the kid to be able to do this, even if it doesn't work into what we can do. And that village is so important anyway, to have, kind of people in our lives who hopefully we can call upon for certain things, and we can get creative sometimes to make that village as well if needed.
Yeah. Which I know is hard, but I agree, is such an important part of parenting, but nobody teaches you how to do that. I almost think society is somewhat set up in the reverse of like, do it by yourself. Like that's how maybe I mean, not supposed to, but like that's the pressure is like to do it all by yourself. But really, I find a lot of value in asking for help or allowing other people to help me.
Yeah, exactly. Because they're often really happy to do it. And then
Mhm.
sometimes they're even relieved because they get to do this for you. And then they maybe have something to ask you also that you could help with that is fine for them to do. And they would be happy to do. So it can end up working really well for people. And I think that's kind of a broader application of the
Mhm.
concept of connection too,
Yes.
is this sort of circle outside of your family
Mhm.
too.
Yes. Yeah.
Yeah, I
Which is so
think.
important.
Yeah, yeah. And I think Michigan Medicine in a couple of conferences that I've been to recently has identified that as like a circle of holding, they've called it,
Oh, wow.
because, yeah, it's like a circle outside of our own family to help the
Mhm.
parent too. What is our circle of holding, right? And
Mhm.
important. It's important for us as parents, and then it's important for our kids because so much is expected of parents these days. And we are parents, and that's important. And we're also people too, and that's important. So we need our own support too.
Absolutely. Yeah. I think, oftentimes people are like, when are you going to have kids? And then you have kids, and then it's like, and then you kind of feel like you're on your own. But I don't think it was meant to be that way. I think we were definitely meant to do rearing of children in connection with other people.
Exactly.
Yeah.
Exactly.
Yeah.
Yeah. Yeah. And I think the more we can remind ourselves of that
Mhm.
nowadays, the better. Yeah,
Yes.
because
Yes.
there aren't these parent reminders uh, sometimes in today's world.
Sure. Yes. Well, and I think it's like, I mean, between the practices and your inevitably, if you have multiple kids, kids are going to have practice at the same time or different locations or whatever it is, right? Or you have to go out of town for something and then your kid doesn't want to miss out on a sporting event they have or activity. And it's like sometimes you can't be in all places at all times. And, something I have to remind myself of is I like to be at all of my kids' things, but I have had to, well, I've chosen really to
Mhm.
not prioritize the practices and just prioritize like the games or the performances of like, I don't need to be there to watch every practice that they do. Right. And so for me, that felt so liberating because I felt guilty that I couldn't be at everything or like I would have to do my schedule differently. And overall it wasn't best for our family for me to do that. And so allowing other families to help out made so much sense. And it felt like maybe some more experienced parents were like so used to doing it, but it was like I normally didn't ask for help. I always took my kids to all the things. And
Mhm.
other parents were like, hey, could we like carpool swap where it's like you take to this and I bring home? And I'm like, oh my gosh, yes, please. Right. So I think the thing is that a lot of people out there also feel the same way.
I think so too. Yeah. And from the kid perspective, I think it adds to their flexibility, their sense of flexibility
Sure.
too. And that's
Yeah.
that's really important. So that different things can be okay. It doesn't always have to be exactly the same way, right?
Yeah.
All of that contributes to flexibility, resilience, um, decreased anxiety over time.
Yes.
So yeah, I think it's just in everyone's interest to have more people involved sometimes.
Yes. Yes, I
Yeah.
agree. Okay, so let's talk about validation. That's a core strategy that you talk about and how parents can validate their kids' emotions. I think oftentimes they worry about like giving in or reinforcing the emotion by like giving it space if they're having
Mhm.
like a meltdown or something. So can you talk to us about this and how validation works?
Yes, yes. Um, it really is. I found in all my years of first training and in practice, it is one of the most important things that we can do for our kids throughout all of childhood and adolescence is validation. We also need it in adulthood, um,
Yes.
absolutely. But it really is in the service of mental health
Mhm.
to validate. And what that means is to, like you said, give space for someone to share their experience in whatever way they're sharing it. And sometimes it's really hard to do because sometimes all we see is a certain behavior or a certain language used that could be mean or offensive or defensive. And then we have feelings that are going to come up in response to that. But as we can talk about a little later too, if we want to, if we can kind of like step back and remember our role, as in this interchange as the parent, right? And kind of view it as its own thing, like its own job. That can be really helpful in thinking about what we're going to say and do next, and not just automatically responding based on our own emotional state that can come up in these interchanges. So validating is let's see, how do we say this? Reflecting back someone's experience to them in kind of an organized way, if we can. So someone may be kind of having all these emotions and expressing them in a chaotic way, but if we can hear them and then try to organize what might be going on and reflect it back, that can be really healing and soothing for the person hearing it, and then it kind of grounds them more in reality, and they can kind of take a deep breath sometimes and be much more okay. Whereas if we fight it, then it's digging in more, and then it can cause kind of more suffering and amp things up more, and it can be the opposite of what we want if we fight it. It's a lot to ask to validate someone when they're really coming at you with the strong emotions, and that's why it's so important to kind of remember the roles, and to be able to say, well, if this is like a job, is this the way I would act at work? I like, right, when I scream back at someone, probably not, right? Because that is not in the interest of what you're doing in your role at all. And it's not in parenting either. But it's so blurred in parenting because we think, well, it's our own family, it's our personal life, but it is actually a job that we're doing. So
that's a really helpful perspective, because I think, it's so easy to react with our emotions at home, and things that we would never do or say at work, that we can more easily do that. We're maybe more triggered, or we don't have as much of a boundary, or we're just like, there's not as much as a buffer. I don't know. Or the expectations around it. There's something that's causing us to react more in the personal situations.
Yeah, well, because personally, kids are in some ways like an extension of ourselves, right? There's this duality at play from the moment they enter our world, right? There's now a duality, and it's so different, and it affects our sense of self. And there's like psychoanalytic language that refers to kids as like our narcissistic extension, just like what it is, right? They're part of us, and so if they're doing this, but that's not something we would do, then that's a real issue, right? So there is such a personal connection, like that can't be denied, and at the same time, they are their own person, and they are having their own individual experience, and it is our job as a parent to be able to hear them and help them learn how to handle the experiences that they're handling or that they're dealing with. So this is what our job is in this dyad, in this duality, right? So it's tricky. It is.
Sure. Okay. Can you talk to us, like, what would validating sound like? So if like my 4-year-old is throwing himself on the floor and he is upset because I have said, it's time for bed, and he's not ready for bed and he doesn't want to go. And I'm like, I mean, it's bedtime. Like, these are facts. Like, you have to go. But that wouldn't be validating. So, like, what does validation sound like?
Yeah. It is bedtime. So stating the fact is fine. This is the reality. It is bedtime. And I know that you're wanting to do this, whatever it is, that if you're wanting to continue to play your game, you're wanting one more book, I know, and we can have another book, and we can have it tomorrow though, because it's bedtime. So sometimes, so validating the experience, I know you want this. That's their reality. You can't deny their reality, right? And this is the fact. Both can be true. So this is the balance we're talking about, right? The warmth and the limit at the same time. That is validating. There's nothing wrong with limits. There's nothing wrong with saying the way it needs to be, right? And this is their experience. The more we can not say no, probably the better. So framing it like you can have this and it's going to be tomorrow, not today. Because it's just digging in less and sticking to the way that it needs to be and the rules and what needs to happen now. And it's in his interest to go to bed. It's in your interest that you go to bed. And it just needs to happen. But if we can use a warm voice, that's better. It's so much easier said than done. I do find that trying to step back and remember that this is my role. It's not my role to be in partnership with him at all. I am the one in charge, and that's part of the job. And being in charge, it's also my job to try to do it warmly if I can. So all of that together. So it's just taking that step back to remember that.
Yeah. Hard, but through practice, right? I'm sure just like practicing it will help to get that to be, because if it isn't something you've really experienced, there's a lot of validation around emotion, then it's hard to mimic that thing. So it might be very challenging at first, but the more that you do it, the easier it will get.
Exactly. Practice. It will become so much more natural to do if the more you do it. Yeah.
Totally.
Yeah.
Okay, so I like this idea of practicing distress tolerance within parenting, because I think we think about it as like a therapeutic thing. Like we're practicing this distress tolerance, but what does it look like for parents to build that skill in themselves and their kids?
Yeah. Well, I think, sometimes parents think if something is distressing to their kid that they have to like fix it or correct it right away. But oftentimes letting the kid kind of sit with whatever they're going through can be in their interest, because then they know that they can sit with it. And then over time, if they experience something distressing again, they'll be able to be okay with it and know that eventually things will be okay. So this builds what nowadays a lot of people, are referring to as resilience, right? To be able to practice this distress tolerance. So, and it can start even when they're babies. If you're at the zoo or something and they have to go without a nap, right? Maybe that's okay for them to feel uncomfortable and tired for a little bit, and then later, they can make it up or whatever. And that's just one example from when they're really little, but over time, things will come up where they're feeling grumpy, grouchy. You can do your best, of course, to meet their needs, but to also know you don't have to beat yourself up necessarily that much, because it's okay for them to feel uncomfortable, to feel distress, and then eventually things will move forward. So yeah, it's an important concept, and we refer to this so much in the field of mental health, like you said, the idea of distress tolerance. And we sometimes will promote exposing people to things that make them uncomfortable in order to decrease their distress and anxiety over time with those exposures. But if we can do that through their childhood just anyway at home, right, then that's already doing that and protecting their mental health along the way. So there's no reason not to apply what we do in therapy and in the field of mental health to the home just at the outset, so that we can prevent some of these things too.
Sure. Yes. I love this idea. So, okay, like let's say I'm thinking of like an older teenager, like let's say that they're having some friendship issues and,
Yeah.
or maybe they're not, maybe they're like, 15, 16. So like still, somewhat connected to being reliant to parents. I don't know that we ever stop needing our parents, right? I think the job goes on forever, but they, bring this issue to us and we're like, oh, I could call Mrs. So-and-so or Mr. So-and-so and get this straightened out, or we can just go to their house. Is it okay for us to allow our kids to feel those uncomfortable feelings of having conflict with friends without stepping in to solve it?
That's a great question. Yes, yes, and even at a younger age, than 15 and 16.
Sure.
This is how they navigate relationships. This is how they learn kind of what's okay with friends, what feels okay, what doesn't feel okay. How can they learn to respond in a way that's going to be effective and practice their interpersonal effectiveness skills? It's important for them to develop those skills, and doing it and learning from how that goes can serve them really well. So, so that's another example of being okay with them tolerating the situation, managing the situation, and not necessarily stepping in to fix it ourselves, even if it's our inclination, because we don't want to see our kid hurt or in a situation that isn't good for them. Certainly, if it has to do with safety or something like that, that's a different story. Like, we all know that. But in terms of this and developing these skills for themselves, that is important to remember. And in general, I think thinking about where they are in their development, what skills we want them to be learning, what should they be learning at certain stages, that's always something good to keep in mind as well on the parenting journey.
Sure. Yeah. Because if it's a norm, it's what we're expecting to happen. It's like, okay, they're perfectly on track, right? Like that, even though this is hard, it's also a skill that they need to be developing. And so we're there to kind of like support.
Exactly. Yeah. So we, as they navigate all of these learning processes along the way, we're always there to support, and we are always like a listening ear, and especially in the teenage years, but really throughout, just being there in a supportive role, and just kind of, them knowing that we're there for them is really, really important.
Yeah.
So,
Well, and
yeah.
I was thinking about how you could use the validating of emotions in that too, of like them experiencing this distress, right? And that you're validating that part of like, this is really hard, like you said earlier. And like, also, is it okay for us to defer for like the kid to decide how they handle that? Like, and how do you want to handle this? So like, this is really hard. I'm sorry you're fighting with Sarah. What do you want to do next?
Right, exactly. Validating, and then they can come up with a solution, and we can be a sounding board for them for that. And they're working it through for themselves, but with that listening ear and support.
Yeah.
And just thinking from a professional point of view, like, really, this is what we do, like what people do in therapy too, right? The therapist is like the sounding board, and often the best outcomes in therapy is when the patients or clients come up with these solutions or solve these problems on their own in the room with the support there. So do the same thing in the home. Yeah.
Absolutely. Well, and I know I sometimes have patients who are like, I want you to solve this for me. Like, what should I do next? And I'm like,
Right.
yep. Okay. Like, let's talk through it. Like, what options do you have? Right. And so I think it is hard because often we do just want somebody to step in and just solve it. Like, just make this go away. But that
Mhm.
really we're looking at how we're growing adults, right? Like how we're teaching our kids to
Mhm.
become more independent because we won't be here forever, right? And so our job is not to take over the pieces, even though sometimes it's like, oh, this will go so much faster if I just solve this for you. But really,
Yeah.
it's about the process of learning how to do it and to trust themselves.
Right, exactly, exactly. Yeah, that concept of trusting themselves
Mhm.
through childhood is, I think, so important
Yes.
to reinforce along the way. And yeah. And so there's so many concepts that that apply to that. Like, so listening to them, giving them the room and space to problem solve around what might be going on for them, also like kind of catching them when something positive is going on. Like we call that when they're little, like catching them when they're good and
Yeah.
reinforcing that. Like, oh wow, that that seemed to go really well. What do you think happened there?
Yeah.
Um, and then they kind of reinforce these things for themselves and
Mhm.
internalize them.
Yeah.
And all that is really helpful.
Yeah. Something that my kids like to hear is when I'm like, "Oh my gosh, you knew exactly how to do that," or "You knew just how to do that," or "That's so cool that you could do that." Like just in embracing that part or encouraging that part of them being able to solve problems or do something that was hard. Of like, my son might ask the littlest one to help put shoes on, but I know that he can do it. And sometimes he just wants, that like snuggle kind of like help, right? And noticing like, I wonder if you could do that by yourself. While I'm putting my shoes, could you also put on your shoes? Let's see if you could give that a try. And seeing
Mhm.
how they do, and then rewarding that, validating how awesome that was that they just did that thing by themselves and they like just beam. Love
Exactly.
it.
Exactly, exactly. It's doing something positive and then hearing that positive feedback and getting the
Mhm.
positive reinforcement. Yeah, like the more sort of positive experiences kids can have over time that they recognize and kind of keep inside them, the more they can accumulate, it really propels their sense of self moving forward, which can be protective against stressors and things that can will happen in life.
Yeah. Yeah. Okay. Can you talk a little bit more about how to balance this like connection and our authority piece? Because I think that
Mm.
it seems very foreign, right? Like this type of parenting, because I think we had been very like, maybe a lot of us were raised very militantly. Like this is,
Mhm.
you're going to like listen, honor, and obey me. Like whatever I say is what you're going to do. And then we kind of have swung to a more permissive parenting,
Mhm.
however you want to phrase that, where we're trying to align with our kids to a place where like we're equals, I think, and that like the kids have as much power as the adults do, which I think is honestly confusing for kids.
Yes, I think it definitely can be when there isn't someone in charge.
Yeah.
Because that being in charge for kids also is an overarching sense of safety. So that still does need to be there
Mhm.
in the childhood experience. So yeah, you're right. The pendulum has swung in different
Mhm.
directions, and this connection-based parenting is so important. We started talking about connection right in the
Yeah.
beginning of our conversation, and it's so important. And at the same time, um, the firmness and the boundaries and the steadfastness is also really important. And so like we said, the authoritative method of parenting, where both are honored, is really thought to kind of yield the best outcomes
Mhm.
in terms of uh, children and people who go on to become really functional, right?
Mhm.
Functional and happy. So they're able to live within the bounds of the limits that we all have to have.
Mhm.
And they can feel like their feelings and experiences are honored and appreciated and important. So those two things together are what we strive for. So in that one end of the pendulum that you were referring to, where it's just my way or the highway with parenting, this sort of authoritarian method is what we call it. That has been associated with like decreased self-esteem and increased rates of depression and things like that. And I guess it does make sense because their experiences and feelings aren't necessarily validated or considered to be important. Then they maybe just kind of shove it down, right? And then it could result in that over time, the sort of depressive experience. And on the other hand, the too permissive, it can be hard to keep up with things that are needed, right? If the parenting style is too permissive, so it's warm and loving, but not adhering to or providing the limits and boundaries that can help someone to be successful and to move forward on their developmental path, right? Because we want things to be in the service of development and helping our kids to move forward. So yeah, it's a balance, but no matter where the pendulum swings, I think coming back to the middle is kind of the tried through way that kids can have their needs met to go on to do the things they want to do and to be as healthy as possible from a social emotional point of view as well.
Yeah. Do you find that kids that have been raised by somebody who's kind of in the middle, right, who provides that structure and support, but also that like warm, nurturing side, do you find that the mental health issues for those kids are less?
Well, yeah, it really can be because they come to understand their own experience. And that is very protective. So to be able to, like if someone's exposed to a stressor, in some people, if they have more trouble kind of connecting the dots, like that stressor caused me to feel this way, and then it led me to do this. If they have more trouble making those connections, then it is a higher risk for mental illnesses like depression and anxiety. And if they have sort of practiced along the way, connecting the dots between stressors to make sense of their experiences and have those be validated, it is protective in terms of mental health.
Yeah. Okay. So if I'm a parent who's listening to this and I'm thinking, okay, I like want to buy into this process and to do both, right? To not just be on one side or the other. What advice do you have for like starting that journey? Like how do parents kind of start to like lean into that? Because I think it seems like simple, right? To be warm and loving and also provide structure and consistency. But I think for some people who haven't really had that, it would be hard.
I think, if you have certain expectations and you share the expectations with your children so that they know what happens at a certain time as much as possible, what they need to do, things that are developmentally appropriate, but knowing what to expect and honoring also the child's routine. And again, that goes along with knowing what to expect, kind of keeping these things in line can set some nice sort of boundaries and limits from the very beginning. I'm trying to think of an example. Like with my own son, when I was leaving him at a little in-home daycare when he was very small, right? I would say, "I'll see you for dinner," and the daycare provider taught me this, which is part of my village,
Yes.
To say like, I'll see you for dinner, and then he knew what to expect, and so if we set the expectations, what's expected of the kid, and then we also are are willing to share with them so they know what to expect, and it can keep some of the organizational structure there. And then, of course, to be warm and nurturing in our responses to them, along the way at the same time, but just kind of holding both.
Yeah, I love this idea of balancing the two. I think so. Sometimes parents, when I give them feedback on like things that could be helpful, they feel guilty that they haven't done something historically a certain way. Do you have any like thoughts or encouragement for parents, like when you, even if it's today, right now, when you're listening to this, that you're like, okay, I'm going to make a change, that would help them to validate themselves, or to not allow them to pick up guilt or shame for like what they didn't do before they knew or had this idea to parent in this way?
Definitely. I mean, validation, you can start it at any time, in the journey. And then it can help both parent and child so much, because the parent can see the child's response when they validate them, and then everyone can move forward more easily. And I think it sucks people down into negative places much less, and that includes the parent. So this can start at any time. And that being said, sometimes we're in such an emotional state that we're not able to validate in the way that we would like, at a certain time. And what can be very powerful also, which may sound obvious, but also some people might think they shouldn't do this with their kid, but what can be really powerful is to apologize. Like if you say something you really wish you didn't, and later you're reflecting on it, you can come back and apologize and say that you're sorry to your kid. And that can actually be kind of the ultimate type of validation, is an apology from a parent, because then they're really coming out and saying, I responded in a way that I shouldn't have. I do acknowledge you had this experience, and I want to tell you that now. And then that can mean so much to a kid, and make them feel heard and make them feel valid and validated. And it's also modeling that nobody is perfect and everybody's going to make mistakes, and parents are definitely included in that. Kids are included in that. And so that's really good modeling for that too, because everybody is human and has their own emotional states.
Sure. Absolutely. Okay. So what do you think I haven't asked you that you're like, these are things that I love for my patients to know or families to know?
Oh my goodness. We've talked about a lot. I think, I mean, we talked so much about validation, connection, attunement. We haven't used the word attunement, but it's along similar lines, where, trying to, so temperament, right? So I guess something briefly to just sort of touch on is temperament. And something that sometimes we refer to as a self-fulfilling prophecy. So sometimes our child can have a different temperament from us, from the parent, and it might really feel very, very difficult. And so trying to identify what that particular child's needs might be, and then try to kind of meet them where they are, and then even try to frame it in a positive way, even if it's something that is hard to handle at times. For instance, if you have like a little kid who is super hyper and requires so much energy and is just really, really difficult to stay on top of, to try to look at that in a way like, wow, he has all this energy. He is so creative. He might be able to do this and this and this, and, frame it in a positive way. Those feelings and those associations make a difference. And,
Sure.
and if we carry those with us through the journey as it pertains to that kid, the kid can internalize some of that. And sometimes then that's what we come to see. And so, just sort of keeping that in mind can be important, I think, along the way, just how we frame things. Like, are we focusing on the negative, or are we focusing more on what the strengths could be associated with some of these traits that the kid might have? And so that's something that I would like people to take as well, is the nature of framing the traits of the kid, and that relates to connection, because it has to do with our interpretation, and then that informs our interactions with the kid.
Yes. Yeah. Totally. Well, and I think, how we look at things matters, right? Like all of that part of, and even like thinking about us as a parent as like, this is like a job I'm getting paid for, right? Like, this is my job that I'm doing. Like, all of that is so relative to what we're also talking about. I think it's really helpful to like shift our mindset around how we're parenting.
Yeah, exactly. Yeah. And to remember, this is what we're doing in this moment. It's not, because again, there's the personal blurring of it, right? That I feel mad, so I'm going to respond this way. But no, this is what I'm doing in this moment, is I'm doing my parenting job. And so then I'm going to try to do it that way, with that in mind.
Yes. So incredibly helpful. Thank you, Dr. Raphael. This has been such a great conversation.
Oh, it really has. Thank you so much for having me on. It was a pleasure talking with you.
Yes, you too. Thanks again, Dr. Raphael. What a great conversation. I hope that you can take away at least one, if not 12 things from this conversation. I love the idea of validating our kids' experiences, and also the balance between the comforting, nurturing parent and also having the boundaries. I think that idea of authoritative parenting is helpful. I don't love the name, but this is what we're calling it. And I think it can be something that can be transformative to our kids, even though they may, reject that if they've gotten a lot of power in our relationship. I think ultimately kids want us to be in charge and to know who that they can count on. With that, I will say thank you so much for your time today. Please like and subscribe to our show. Follow us on Facebook, Instagram, TikTok, and YouTube, and keep the emails coming with future topic suggestions to accidentalexperts@gmail.com. Have a beautiful day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.